Hey guys, so here we go again with a lecture on diabetes and other conditions of the endocrine system. So I guess no need for more introduction, we'll just jump into it. Here we go. So we've talked about the nervous system, and the nervous system uses electrical impulses to communicate from the brain to the body and back up, right? So up the spinal cord and down, up and down the spinal cord, and to all these different places of the body. I'm actually going to get out of the way so I'm not standing in front of all the words. The endocrine system is another form of communication, but it uses hormones. So it's like a chemical communication system. And it's in charge of basically all these different things and more. Again, like most lectures that we've been talking about this semester, this is going to be a pretty simplistic understanding of how this stuff works. But just generally speaking, the growth and development of the body and the brain, hormones contribute to that. Hormones help us. Oh, by the way, one other kind of really important fact here, that when we talk about this concept of homeostasis, equilibrium, or balance in the body, we've talked about that multiple times in different ways. We have this fight or flight response, and we get really excited about stuff, and then we have to come back down. And the body gets really active, and then it has to rest. And all these different ways we're sort of maintaining balance. Hormones play a huge role in communicating whether the body needs to ramp up or calm down. And so we're going to talk about that in terms of how that affects our mental health in a little bit. But this, just so we know, we're kind of in that ballpark of saying when it comes to growth and development in the body, we need to grow, but not too much. We need to grow, but not too fast. So we're kind of finding that balance here. Reproduction. The hormones have a role to play in reproduction. Metabolism, which is just sort of like using energy in the body. Internal and external stress adjustments, that's specifically one of the things we're going to talk about. But just generally speaking, that's one of the things it does. And then water and electrolyte balance. So how much water, too much, too little, too much salt content in the water, that kind of thing. If you want to see, well, I'm not going to go through all these different hormones and all the organs and do the anatomy lesson, but there is a good table on page 375. Let me just actually, I kind of want to flip to it and see if there's something that I want to say about it, but I don't think there is. It looks like this. Right? It's got a whole big list, different parts. You've heard of the thyroid gland, the adrenal glands, the pituitary gland, hypothalamus. You've heard of probably a lot of those things in science classes and stuff. I'm not going to go through all those specifically and what the different hormones are, because that's beyond what we really need to do here, I think. But we will talk about a couple of them. One of them that I specifically want to talk to that I think many of us hear about, I'm going to adjust the microphone here just a little bit. One of them that I hear about a lot is cortisol, because that's kind of has been branded the stress hormone. Cortisol is, you try and pronounce that word, glucocorticoid. I think that's how it is pronounced. I might have just butchered that, but glucocorticoid. It's basically a steroid. The body produces natural steroids. We know steroids because they build muscle, and they have like sort of these healing properties that we can introduce when somebody needs to heal the body somehow, right? Like just doctors deal with that kind of thing. Well, this is a natural steroid. The reason that we have these is because they help regulate that stress. In other words, when cortisol floods the bloodstream, what it's trying to do is trying to say like, okay, there's something really going on here, and cortisol is going to help us calm down. It's going to tell us like, oh, okay, stay vigilant, but then we got to calm down from that fight or flight response. So when we say like, oh, you got cortisol pumping through your veins, it's because we have this heightened fight or flight response, and the body is saying like, okay, send the cortisol, tell everybody it's time to bring it down a notch, right? So too much cortisol tells the body that it's in this state of kind of panic or state of stress, I guess we could say. The purpose of it, though, is to help us calm down, to help us come down from this. So another one of its functions is to suppress inflammation. In other words, like if the body thinks something is broken, it's going to send a bunch of chemical and electrical signals of pain and like cells to go help fight infections and that kind of thing. The inflammation is what helps protect the body, even though it feels painful to us, right? So this is it's a little bit confusing. Cortisol helps suppress inflammation. Essentially, cortisol is out there saying, hey, everybody's freaking out. Everybody needs to calm down a little bit. We don't need to inflame right now because it's not necessary, right? So the reason we talk about this in terms of our stress is that when we lived high stress lives where we are constantly in a state of like fight or flight, anxiety, I've used the analogy of to me, I always think of a neon light buzzing. It's just like your brain is kind of like bzzz, constantly feeling like it needs to be vigilant and on alert. And cortisol then is present throughout our whole body, and it's supposed to be calming us down. It's supposed to be sending the message that we need to calm down. So, it's telling the body it's not in danger. It's not injured, something like that, okay? Too much cortisol and for too long can create problems. One of the points here is that it can reduce sleep. So you might have heard this in I don't know, like marriage counseling before you get married, or I don't know. When you have partners, it's really not a good idea to go to bed angry, because then you lose a little bit of sleep, and then the problems still exist overnight into the next day. And it's kind of ideal if you can resolve your conflicts before you go to sleep at night. And this is one of those reasons. It's biological. It's not just a matter of like, well, then we got to deal with the crap tomorrow, right? So if you have too much cortisol, it keeps you from sleeping well and getting good rest. So here's just another part of the function of this hormone. There's a bunch of other things that cortisol does, and it's kind of, like I said, beyond the scope of what we're going to do today. But it helps regulate metabolism and blood sugar and all that kind of stuff. So this is going to lead us into the first condition that we're going to talk about, which is, diabetes. Did I go too many? No, we're good. So diabetes is one of these, it's a malfunction of our insulin production, basically. And if you kind of get the picture now, hormones do a lot of different things, a lot of different places in the body, and they have a lot of different associated symptoms that are possible with it, okay? And when something goes wrong with the endocrine system, there are all these different kinds of reactions, from emotional to behavioral to, from all over our body, and they affect us just in all these different ways. And so diabetes is one of those things, like, when you get it, if you have it, it can affect you in lots of different ways too, okay? So it's a little bit challenging to talk about because it affects so many different parts of life. But here we go. We're going to try and break this down anyway. Diabetes is the leading cause of blindness, end-stage kidney disease, non-traumatic amputation, and it's also a major risk factor for amputation, stroke, heart disease, peripheral neuropathy, which is pain in your extremities, and erectile dysfunction in men. Also, we'll talk more about sexual dysfunctions later too, but for women, it's reduced sensation. So it is really impactful. And I guarantee you've seen somebody and you did not know that they had diabetes and that they were living with some of these conditions, right? Because sometimes you can't really see this stuff because it lives on the inside. But nevertheless, people are living with these kind of conditions. I described to you before somebody that I had worked with in the past who had some vision loss due to type 2 diabetes. So we've kind of touched on this subject before, and now here we're talking about the condition itself. Most people are kind of familiar that there's two types of diabetes. Type 1 is the less common, and it's typically, it's like we don't really know exactly where it comes from and why people get it, but it has a little bit to do with genetics and environmental circumstance and that kind of thing. Whereas type 2 has more to do with like behavioral. In other words, like your diet can really affect whether you have the onset of type 2 diabetes. So let's explain how they work a little bit, and that'll make a little more sense. With type 1 diabetes, it's kind of like the insulin production system of the body is just not working. Either it doesn't produce enough, or it's sort of inconsistent in its production, which means that somebody with type 1 diabetes has this, it's kind of like just an organ failure, for lack of a better term. And so you have to introduce insulin into the body in order to help the body break down sugar. That's what insulin does. We eat sugars and complex carbohydrates that then break down into sugars, and the body sends insulin so that it can help metabolize that stuff. sort of break down those things and use it for energy like it's supposed to. But if the body doesn't have that insulin, it can't do that, so the body can't get energy. It's kind of just a really rough way of looking at it. And so we'll talk a little bit more about what that means for a person, but basically they need to inject insulin into their bodies. Probably all have seen those little red containers in bathrooms for the sharps containers, what they call them, for the poking needles and that kind of thing. Type 2 diabetes makes up 90% of the people with diabetes, with the diagnosis of diabetes. And the way this one kind of works, and this is, again, really rough, but the way it kind of works is that if we intake too much sugar, which is common for many Americans, which is why this is such a pervasive condition, if we eat too much sugar, our body says, okay, produce more insulin, and then we keep eating more sugar, and it's like, produce insulin, and okay, now our insulin production system is ramped up almost all the time because of the large amounts of sugar that we're consuming. And eventually, it can kind of just break, right? Or it's overproducing insulin, and then it gets tired, just sort of like a worn-out old car. After 200,000 miles, the car's just like, I'm done. I'm going to blow a rod in this thing, and it's just going to not work anymore. So, in other words, if the system kind of breaks, we just can't keep up with the demand of how much insulin is needed because it sort of tires out. That's kind of a rough way of explaining it. Okay, so there is this condition called hyperglycemia, which basically means there's too much blood in the sugar because we're constantly eating sugar all the time. We have too much of it, and then the body can't produce that much insulin, and that becomes problematic. So too much insulin is not a good thing. Too little insulin is not a good thing. Too much sugar is not a good thing. Too little sugar. Here we go back to that idea of balance, okay? So we don't necessarily have to understand all the science about how this stuff works and all the mechanics of the hormonal balances in the body. What we do want to understand is, what does this mean for a person's life, particularly their wellness, their mental health, and their relationships. That's what counselors do. But let's talk about management, because we have to talk about this in order to get to that part where we want to get to. So we talked about insulin injections. There's lots of different kinds of medicines that act in a different way. There's stuff that you put it in your leg or your stomach or whatever it is, and it acts right away. So the rapid acting, short acting. There's intermediate and long-acting variations on medication. So, you inject it and it doesn't actually sort of take effect or start working for a while. You guys are probably familiar with this in terms of other kinds of medications. Some of them will hit you right away. You have a headache and you take a Tylenol. In a few minutes, you can potentially feel a little bit better. When it comes to things like antidepressants, sometimes you have to take the thing for 6 weeks in order for your body to get up to effective dose and to sort of do something beneficial for you. Same kind of thing here. That's what we're talking about. Insulin must be balanced with food intake, particularly sugars and carbohydrates, like we mentioned. So there's almost like this constant teetering of like knowing how much blood you have in your, how much sugar you have in your blood, and balancing out appropriate levels with your amount of food that you eat and the kinds of food that really matters, and then how much insulin your body has in it and how much it's producing, right? So you're constantly playing this testing and retesting kind of thing. In the old days, it happened with little paper strips. You prick your finger, and then you put the test strip on it, and you do the thing, and it was really like, for lack of a better term, old school. And now there's computer systems, basically, like little monitors that can do that much quicker. So it's changing and getting a little bit easier. But nevertheless, part of the big challenge with management of diabetes is this constant monitoring and constant adjusting. It's just like such a frequent thing. And it becomes so much of a priority of our thinking, if you have this, that most of us take for granted that our body just works, and then all of a sudden now we have to hyper-focus on this part of like constantly watching it. People can get used to it, totally fine, live completely normal lives for the most part, but it can be an adjustment when we talk about adjustment to disability. When it comes to diabetes, it's getting used to all the different considerations of, do I have enough food on me just in case I'm too low in blood sugar? Do I have all my needles? Do I have all my insulin? Do I have all this stuff? And it's kind of like, for anybody who has kids, it's kind of like you have to think about packing your diaper bag every time you leave the house when they're young. And it's always something you just have on your shoulder or have with you, and it's like an added thing to think about. It just takes mental space. So that's part of what we're talking about here. Management is just building in the ability to sort of forethink about this stuff. I think that we've kind of mentioned all this stuff. The other thing is too is that you can get insulin pumps that pump insulin in automatically at various levels with the test. I recently met a guy who had a thing in his arm, and he had a little, it looked like a cell phone or a GPS locator or something, and he would put it on his arm, it would beep, and then it would automatically send insulin into his body at the appropriate levels to equalize within the range of, whatever. Or he would have to eat something in order if his glucose levels were too low. But basically, that's the idea. There are two associated conditions here. There's hypoglycemia. Here's those prefixes again. Hypoglycemia, or too little sugar, and hyperglycemia, too much sugar. And here's some of the symptoms associated with what happens. So let's say a person has too little sugar in their body. How do you know? Well, it comes from more than just test strips and little beeper things on your arm. If you start to feel hungry, if you feel weakness, if you're getting anxious or you're feeling confusion, rapid personality changes is something you'll see sometimes, or you might have even heard this because there's enough public knowledge and public education about diabetes that you may have heard of somebody who is like generally a kind and gentle person, I guess, and then all of a sudden they freak out and like get super angry and just like violently angry really fast. And it's not because they're really a mean person, they just didn't have enough sugar in their body, right? Which can easily be fixed with proper management. That's really the moral of the story here. Also seizures and potential to lose consciousness if not remedied quickly enough. Hyperglycemia, or too much sugar in the body, can potentially lead to diabetic coma, diabetic ketoacidosis, which is the breakdown of fats. There's a description in the book you can read about what that means. Some of us think, oh, well, I put on a few pounds. Wouldn't it be nice if we could break down fat really rapidly? But the problem is if it breaks down too fast, the body doesn't know what to do with that, doesn't know how to kind of run it through the system. It'd be it's kind of like a clogged sink. Like you put food can go down there, but if you put too much too fast, it's going to clog the system and back up. And it's kind of a stupid analogy, but you get the idea, right? Like it has to happen at the right time and at the right pace. So some of these things can be fatal, potentially fatal. So it's really, not only is it sort of obnoxious to be hungry, but it's also potentially really dangerous to have this happen. So the moral of the story that we're going to keep returning to here is that proper management is so crucial, because it's not just an inconvenience or like, oh, I'm going to take a sick day. It's like this stuff could be really potentially fatal, and so we want to build in as much stability in our lives as possible. In other words, we have to, in order to manage this condition, we have to make lifestyle changes, which are some of the harder ones for people to make, right? So part of the lifestyle change is strict dietary management. In other words, you probably get the picture already, but you have to maintain that proper balance of sugar in the blood, which means, well, in class when we go over this, I'm going to ask people what they think that means. Here's a few suggestions for you. If I have, I can't be switching jobs all the time, or I can, but it's going to make management of my chronic condition much more difficult, right? If I'm doing shift work, and some days I go in the morning and sometimes at night, that instability or lack of consistency, rather, can be very challenging for somebody who has to have sort of order and structure to make sure they have planned out their food and their exercise and all that kind of stuff. Sleeping habits. If a person is sleeping inconsistently, sometimes during the day, maybe because of rotating shifts or whatever, sometimes not sleeping enough or sleeping too much or whatever, that could be due to other conditions, or it could just be due to, my lifestyle doesn't allow me to go to bed at 10 every night and wake up at 6 or whatever the timing is. Food availability too. So many of us, shouldn't say many of us, but there are places, you may have heard the term food deserts. There are places where people just don't have enough food available, right? and this is kind of getting into more sort of sociological sources of this, but I don't really know this for sure, but I'd be really curious to know if there are places in the US, just for sake of example, that have higher rates of diabetes. Think of a place that does not have access to adequate healthy food options, and people eat more things like gas station food. I'm thinking of like urban environments. And people who live in those urban environments where more sugar is present in the diet don't have necessarily either food available options or food at all, so not enough food. And these can stress the body and stress the system, either too much sugar or too little sugar, right? Not enough food or the wrong kinds of food. And that means that if you live in one of those environments, you're more at risk to have an unstable lifestyle. In order to manage this condition, you have to have that stability and access to health, right? So this is not just an issue of like, do I have enough food in the freezer? But this is an issue of poverty and race and social justice and all those kind of things too that I would guess affect this in a significant way. I don't know enough about the sociology of it, but nevertheless. If a person has specific religious practices of you can't eat this kind of meat, you have to fast during this time. If you there's all kinds of dietary restrictions that come along with religious practices, and managing a condition like this can be really challenging. A lot of us know somebody who has a gluten allergy or has dietary restrictions by choice or by force, essentially. By choice, vegetarians or vegans. And the challenge was sort of pre-planning and thinking, just having that as part of your mind space. Some people do that voluntarily. Like, I want to be a vegetarian or vegan on purpose because it does something for me, and so I'm incentivized to do it. Somebody with diabetes does not really have that same luxury of saying, I'm doing this by choice. It's, I have to think about where I'm going to get my food, healthy access to healthy food. Do I have enough? Is there too little? If I go out on a vacation, am I going to have access to the right kinds of food that I need? If I go on an airplane, am I going to have access? Is that food going to be adequate to meet my physical needs? All that kind of stuff. There's just so much forethought that goes into this. And then, of course, not just dietary considerations, but physical activity too, especially work activity. So this, I just put this as kind of a side note. I keep plugging this idea of like, a vocational rehabilitation counselor who understands diabetes and who knows a little bit about this stuff can say when a person's sort of choosing their career or they're trying to find a new job or whatever, can help a person say, have conversations with employers or with the person themselves and say, this kind of work would be great, but it's really going to make management of your chronic condition really difficult because of, lots of time on your feet, or you're constantly moving, or you're constantly sitting, or whatever. So that's part of what rehabilitation counselors can do, is help understand what work fits you given your condition, something like that. Okay, this earlier when I said there's lots and lots of different ways that this affects the body, I'm going to cover just sort of briefly some of them. So it affects the condition of the eyes, particularly the way the blood cells, the blood vessels in the eye bring nourishment to the eye. Retinopathy, we've talked about what that means, glaucoma, and potentially blindness. So as somebody's diabetic condition either worsens or just over time, it can really affect the eyes in this sort of degenerative way. Lots of different ways, and a lot of it just is like changes in blood supply and how it feeds the cells of the eye and that kind of thing. So blindness is a potential. Kidneys, same thing, relates to the blood vessels and it getting what it needs to function. Kidneys are, well, we'll just leave it at that. Kidney failure is as a potential. Nerves. So we talked about peripheral neuropathy. Peripheral means the hands and feet, basically. The farther regions of a person's body. That's the periphery of their body, not the core. Neuropathy just means nerve pain. So pain, tingling, numbness in extremities. You'll see down here at the bottom when we talk about amputation, one of the things that can be challenging is if somebody has numbness or reduced sensation in their extremities, that can create problems if somebody gets cut. So here again, we're like, think about a job where somebody's on their feet all the time. Maybe they're working around things where they could drop something on their toe, and they don't really feel that something's going on down there and something's wrong, and the body doesn't really know to sort of protect that area or mend it, I guess you could say. Then they can get conditions where, maybe they get an infection they didn't know they even had, and so these kind of things can contribute. As soon as there's nerve problem, can lead to things like amputations and that kind of stuff. The amputation thing is not just due to nerve issues, but that's part of it. Nerves are not only there in our extremities, though. Nerves go all over our body. We have our autonomic nerves, which do sort of, for another way to say that would be like the automatic processes of our body, our heartbeat, our organs, like our stomach has, the process of, if you've ever seen like a snake shed its skin, it has these like undulating movements of like kind of pressuring out of its, to shed its skin. Our stomach uses that same kind of movement to push food down the digestive tract. It's called the peristaltic movements. And it pushes that stuff down the tract. When there is autonomic nerve damage, the body can't really tell if that's happening. And so sometimes the brain will be like, excuse me, stomach, are you still doing that thing that you're supposed to be doing? And the stomach's like, I don't know what you're talking about. And those nerve misconnections or mismessaging or something can create problems, which we've kind of talked about before. One of the responses to fix some of those problems is to change the blood pressure, higher or lower, change the heart rate. So when somebody has these communication errors, they experience symptoms like nausea, vomiting, indigestion, constipation, diarrhea, and those are all protective factors, like protective things that the body does. Like think about diarrhea. Hey, you've just stuck some bad food in your body. You got food poisoning, something like bacteria or something. We need to get rid of that as fast as possible. So we're going to try and purge from both ends, the whole GI tract, right? And to us, it's like, oh my gosh, that hurts and it's uncomfortable, but it's the body's way of saying we need to stay safe here. Same thing with raising and lowering blood pressure. So whenever we're talking about communication errors, either chemical or electrical, with the nervous system or the endocrine system, we have this system, these symptoms of the body trying to say like, okay, correct for this. Send inflammation. Wait, no, don't. Fill up with cortisol. Wait, no, don't. It just gets really confused, right? So that's kind of what we're talking about here. We did mention sexual dysfunction here briefly. Erectile dysfunction in men, there's a statistic in the book, I think it's like 50% of men with diabetes experience erectile dysfunction. For women, it's just reduced sexual sensation. It doesn't necessarily damage the reproductive system aside from like the mechanical loss of getting an erection or having sensation during sex and like orgasm and stuff like that. Women could still carry a baby. Men can still be fertile. There just has to be some other management of conception, something like that. Also, cardiovascular system, it's going to affect the blood, right? Like in the heart and how it works. And then we've already talked about amputations. So now we can kind of get to the part. We talked about the management challenges. We've talked about some of the secondary effects, or that word sequela that we've mentioned before, such as heart disease and blindness and all that kind of stuff. Now we can talk about the psychosocial issues, taking that stuff into consideration. So one of the things that happens is if I have to constantly manage my food, and I have a bunch of friends who are like, hey, let's all get together and go out to eat. Let's go to like such and such restaurant. And I'm like, well, okay, but I can't eat anything on the menu, so I have to bring my own food, which means I'm like bringing a sack lunch to some hibachi grill or something like that. It's not quite like that, but nevertheless, you kind of get the idea. How all of a sudden I might just want to say like, I'm just, screw my diet. I'm going to go out and have a good time with the guys or with the ladies or whatever. Or, I'll just pass up on that bike trip with my friends and I'm not going to exercise. You know what? And I'm so sick of taking these stupid medications. And so the motivation to like the fatigue of managing that constantly, people can just have these like, screw it kind of moments and just be like, I don't even care. I'm just mad at my condition because it's not allowing me to live the life that other people get to live. So that's what we're talking about with that first point with motivation, okay? Just sort of wanting to not follow through with that management plan that's so crucial to maintaining consistency and stability and then managing the condition well. Because then what happens is the person has these sort of stays in the ER, or they have other secondary conditions that either they experience right away, nausea, vomiting, constipation, whatever, or potentially they're just putting them, even though you kind of skip on your diet here and there and you skip on your exercise regimen, you're putting yourself at future risk of other complications, which is a story that all of us know, but the consequences are a little more dire here. So that's one of the psychosocial issues we're talking about. Part of that is also this idea of just not fitting in. So imagine my niece has type 1 diabetes. And I've never really talked to her about this because we're not super close. And so I haven't really spent much time with her discussing this kind of stuff. But the idea of not fitting in, when you're still trying to sort of develop who you are and developing kind of a social identity, and there's also this thing about me that nobody really can see, but it's really strange when someone says like, hey, you want to go out, go do this thing, go out to eat, go to a movie, go whatever, and I'm like, no, I really can't. I can't really fit into that social group if I can't because I'm restricted because of my management plan, something like that. So this idea of fitting in can be a big theme in people's lives, particularly younger folks who have diabetes. We've already talked about that third bullet point, so I'll skip over that one. If a person starts to do a little bit of like, well, I'm not going to go to the movies, I'm not going to hang out with my friends, I'll just stay home. In fact, it's just a lot easier to not have friends. So I'll just kind of isolate myself a little bit. But I'm actually kind of feeling a little bit lonely. And loneliness then turns into depression, which then can exacerbate the lack of wanting to manage this condition and still participate in life. So the depression then reduces motivation to adhere to the plan, which creates more problems, which increases isolation, and it starts this nasty cycle of kind of downward spiral of a person being more and more sick, both mentally and physically. So depression is really something to watch out for with a condition like this, which I wouldn't be surprised. I just talked to a guy who worked in a clinic where they managed a lot of chronic conditions, and he would give presentations about mental health to patients and clinicians about what does depression even look like, particularly for somebody who works in a diabetic clinic, something like that. And so that's an opportunity for all of us to say, I might not have to know all about diabetes, but if I know enough about mental health, I can talk about this sort of downward cycle of management of lifestyle versus reduced motivation to participate in like taking your meds and eating healthy and all that kind of stuff. So we'll talk again a little bit too about family members and working with the family members, because as you can imagine, just picture a young person, like maybe a 11, 12, 13, 14-year-old, whatever, it doesn't really matter, and family wants to go on vacation, but they have to sort of help this person learn how to manage their condition, right? So they're helping pack for the vacation, all that kind of stuff. And we've talked about this idea of dependency before. Let's say mom is really on the ball and is this young girl's primary advocate, and mom takes care of all the making sure we have needles, making sure we have food, let's call the plane ahead of time, because you can't expect an 11-year-old to do that kind of stuff, right? Kids just don't do that. But if mom doesn't give up those responsibilities and put them on that individual, then they can create that sort of dependency. And while it's great to have mom as an advocate, mom also needs to back off a little bit as the person grows up. And that's true of lots of different conditions, but this is another one of those where a person can grow up not knowing how to manage the stuff, not knowing how to keep balance, not knowing how to stay motivated to exercise and eat right and do all that kind of stuff. In terms of employment, we've already mentioned again the significant need for planning. Bosses don't necessarily understand that. One of the things that bosses and managers do is they say, hey, look, you're here. Sometimes we care about you and care about how you're doing, but really you're just here to do a job. And so we're going to talk about what's the job that needs to be done. But I'm the person with diabetes, and I'm like, okay, that's important because I'm here to work. But I also have this other thing I have to think about. I have to pay attention to my If I start to feel confused or hungry, like we talked about earlier, I know I have to take time out of my work to go, inject insulin or do something to manage my condition. Most people are pretty good about understanding, like, okay, yeah, go take that break. But we're not necessarily always good about saying, like, let's prioritize that management of your conditions so that you can show up to the job. We think, well, what's the job? And why are you going out and taking breaks all the time? And why are you acting this way? And that kind of stuff. So helping employers understand the need for planning that and what the consequences are can really help somebody be a little bit more compassionate and understanding as to how to accommodate this condition at the workplace. In my experience, the people that I've seen who have a diabetic condition, most of them have been pretty good about, like, they've lived with it long enough, they know how to manage this, and they even know how to talk about it and really discreetly kind of just remove themselves and come back to work. So this is not one of those conditions that requires tons and tons of explanation. But most often as a rehabilitation counselor, when I've talked to people with diabetes, it's not me understanding their diabetic condition and symptoms and all that kind of stuff. It's helping them understand the expectations at work and helping them understand here's how you can slip out really quickly and how you can sort of manage your condition so it is discreet. Because if I start, like, imagine I'm a professor and in the middle of class, I pull out my shirt and start poking myself in the belly with needles. Awkward, right? So I'm probably going to do that in between classes or something like that. Most people get that sense of discretion, but they don't necessarily think, like, oh, I probably shouldn't take that job because I'm going to be on my feet all day long and it's going to burn me out. And I have to take breaks even more frequently because I'm spending more energy, burning more sugar, and then I need more insulin and all that kind of stuff. So understanding work is more what I've done as a counselor. Here we go. A few more things. Kind of already mentioned these. Rotating shifts are unstable. They're not predictable and consistent. Being on your feet should be avoided, particularly related to foot health. And then protection from even minor cuts and things like that, because the body's still, how we talked about cortisol and reducing inflammation. The body doesn't necessarily know how to deal with that kind of stuff as well. So avoiding risky situations that could hurt. Not just hurt, but like threaten the body, even in these kind of small ways. Okay, there are other conditions. I'm not going to go into them in great detail, but hypothyroidism, if anybody's ever seen a picture of somebody with a goiter, it's like a swollen thyroid gland on the neck. It just looks like a big growth gland like this. It's not a tumor. It's a totally different thing. It's treated with iodine, but the thyroid basically... hypothyroidism increases the metabolic rate, so the rate at which the body burns energy. Can lead to things like heart palpitations or tachycardia, which is a fast heartbeat, that kind of thing. I think I said this correctly, but hyperthyroidism, so increased metabolic rate. Hypothyroidism, I'm not sure if I said those right, but there's a distinction. Hypothyroidism is a decreased metabolic rate or slowed metabolic rate. So in either case, it's a dysfunction of the thyroid. Somebody with this condition can experience things like cold intolerance, fatigue, weight gain. There's a whole list of things here. Brittle or dry hair, slowed voice, and low-pitched. So we're now getting into the realm of what does it look like for a person? Not just their hair and but like their behavior as well. So slowed mental processing and reduced emotional response. So we're getting the picture here of somebody who has kind of just like a flat affect and doesn't really seem to really respond very much and kind of slows down a little bit and, maybe a little bit aloof. This is maybe a more extreme version of what you might be thinking, but I'm doing it just for sake of demonstration. Also, there's potential of psychosis development, and that can be like psychosis with paranoid delusions. Memory impairments and dementia, those are also potential parts of this that could happen. I don't know a whole ton about hypothyroidism, to be honest, so I can't really give you much more than that. But as you can imagine, you might start imagining what a counselor's role is with any of these things, right? It's helping a person understand their condition. The doctors will tell them the physical and medical, but you can say, well, this is kind of, if you feel like you're slowing down and having memory lapses, this is part of your condition. It doesn't mean you're stupid. But that has a lot to do with our self-concept and how we view ourselves, our self-esteem, and that kind of thing. So really coming to terms with our limitations is one of those challenges that rehabilitation counselors, that's what we're there for. That's what we do. It's true of just about any kind of mental health therapist, but that's particularly true of somebody who works with somebody with medical conditions, that kind of thing. Okay, Cushing's syndrome. I'm going to take some water. Oh, crap, I don't have any. You guys are going to see me lick my lips a lot because I'm a little parched. Cushing's syndrome is overexposure of cortisol. We talked about cortisol. If that stays in the body long enough, the body thinks it's constantly freaking out. Cortisol is telling it to calm down, but it's just sort of an imbalance in the system, right? Cushing's syndrome, if a person has too much of it, by the way, when we talked about cortisol before, let me just say this first. When we talked about cortisol before, we talked about it as like a fight or flight stress response. You can imagine somebody who lives in a really unstable, unsafe environment. I think I'm not positive about this, but I think that's a different thing than what Cushing's syndrome is. Cushing's syndrome, I think, is like an overexposure of cortisol, not because a person lives in these environmental circumstances, but because of kind of a malfunction of the gland itself that produces this. I think it's part of the adrenal gland. So it's mostly physical or maybe genetic and maybe contributed to from environmental circumstances, but we're not talking necessarily about just like an overexposure to environmental stress here. This is a little bit different thing. Rounded face, obesity, weakness, hypertension, facial growth and facial hair growth in women, depression, anxiety. These are all kind of parts of the condition that come up. And so it may be that you meet somebody who sort of fits this bill and you might think, oh, you have depression, let's treat that. But if you don't treat, if you're not in collaboration with the rest of her treatment team, the medical treatment team, you might be going about this all wrong. So this is particularly one of those areas where therapy is not just about broken hearts and damaged psyches. It's also biophysical, bio-emotional. Wait, that's not the right term. It's also about our physical mind-body. There we go. That's what I'm thinking of. Our physical and mental life. Could be the cause of a certain mental health condition could be the body, or it could be vice versa, right? Mental health conditions lead to things like panic attacks, which are not really problems with the heart, but it sure feels like it. It can go both ways. So that's why knowing a little bit about this stuff can be very helpful. Cushing's syndrome, remember when I said it wasn't necessarily environmental exposure to the unsafe environments or whatever? It can be caused by steroid use. So for men who are trying to get ripped or athletes who are trying to perform better, this is kind of a concern. This is one of the outcomes of potential problems. Also, tumors. Maybe there's other stuff too. I'm not totally sure. But continuing on, adrenal insufficiency, reduced hormone production of the adrenal gland. Gestational diabetes, we didn't mention that earlier with type 1 and type 2, but there's different kinds of diabetes in addition to those more common kinds. It's a temporary condition related to pregnancy. It doesn't last after a baby is born necessarily. And then there's this thing called diabetes insipidus, which has to do with the kidneys. It relates to kidney function. Okay, last slide. Some endocrine conditions can be mistaken for psychiatric conditions. This goes to that point of like, is the person angry because they're low blood sugar? In which case the primary treatment should be, let's get you a Snickers bar so you can get some sugar in your blood and then you're not going to be angry anymore. Or if I'm a therapist and I don't think about these things, or I don't notice that, hey, maybe there's a biological explanation for this, and I say, well, you're depressed. Let's talk about your family history. Tell me about your mom. And they're like, okay, I had a pretty good childhood. What do you want to know? And we're like, well, there's got to be something going on in your subconscious, because there always is, right? If we look at this and say, I'm digging for the wrong kind of thing, when I could be considering, well, let's rule out mental health conditions, but let's rule out biological conditions. And sometimes if a person is experiencing psychosis, part of the reason that inpatient hospitals are at hospitals is because there's access to medical teams there too. And that can be an important thing that we sometimes as counselors overlook. We can say, well, I only am trained to see the behavioral and the emotional and the cognitive, those kind of things. I'm only trained to see that, so I forget to see all these other things. So it's possible to mistakenly call something a psychiatric condition when it's really not. That's the point here. So my example is somebody needs to be given insulin, not compassion for their anger. It's just one example. Body image issues. If you can imagine a person who's just living their life and all of a sudden the doctor says, hey, yeah, you're not feeling well. What you have is type 1 diabetes. And now I need you to pay attention to your feelings, your emotions. I need to pay attention to your hunger and pay attention to all these things really cognitively, like in the forefront of your mind. Pay attention to what your body's doing and how it looks and how it feels. And you got to keep poking it with needles, which means you got to lift your shirt and look at your belly all the time. And like that kind of stuff can lead to a hyper focus on, well, what is my body, how does it work, and how does it look, and all these things. So body image issues can be a big thing. Particularly, I've heard there's I don't know what the actual science is, but there's higher rates of eating disorders with particularly girls, teenage girls that have type 1 diabetes. So it's like it's a risk factor. Diabetes is a risk factor for eating disorder in younger girls. And you could probably imagine why that is, because, it's not just about Hollywood visions of what the perfect body looks like. It's how am I going to fit in with my girlfriends when everybody's eating popcorn at the slumber party, when I have to say, no, I can't do that. And just all those associated things that go along with management, and then the sociocultural kind of stuff too. Also, when we were going through diabetes, talking about things like weight gain is common because the body's trying to figure out how to deal with sugar and what to do with fats and all that kind of stuff. So if weight gain is common, you can imagine the body image issues around that too. So therapists and counselors can be beneficial not just to help understand the world of work and not just to understand depression and anxiety, but also the associated conditions that come along with this. Is like, I'm just weaker, I'm more tired, I've put on weight, and I don't like this me, but I can't help it because it's part of the chronic condition that I have, and I have to come to terms with the new me, the new body, the container that's holding this heart, that kind of thing. So body image issues, social isolation, we talked about kind of how that can develop, and being aware of that and helping a person sort of build in more social participation. That's a therapeutic activity that absolutely warrants some attention. And especially in this population. For those of you that are interested in things like eating disorders, nutrition, diet, exercise, that kind of stuff, like mind-body wellness, we have these romantic visions that we're going to help people like, oh, let's motivate you to get up and go to the gym and work with your personal trainer, and let's motivate you to say, you know what, screw those cultural expectations about what you're supposed to look like and feel like and all that kind of stuff. And we have these romanticized visions of working with teenage girls because I was a teenage girl once and I struggled so much and it hurt so bad and all that stuff. And yet, most of you will also see people who are in their 50s and 60s who are dealing with diabetes who have a completely different lifestyle, but it really fits into that same kind of, area. If you're interested in diet, behavior change, and food, nutrition, and wellness just in general. So you will likely see some of these clients. And then lastly, we've kind of touched on this already, but treating families for not just that dependency stuff, which kind of goes to this learned helplessness, but if you have imagine like, your daughter just got diagnosed with diabetes and you're like, well, we want to go on vacation. And now I have to call the airline to make sure they have the appropriate kind of airline food. And I have to call to make sure they have appropriate disposal for needles on the plane. And I have to think about all this. And all of a sudden you could see why, or maybe not all of a sudden, over time you can maybe imagine how somebody would be like, oh, I just wish she wasn't like that. And you get resentful about things that are outside of that person's control. And so working with families to say, these are patterns that can develop. Watch out for that, because that's going to create problems. Dad or mom or whatever gets resentful, is trying to help the daughter as much as they can out of complete love, and some of that frustration sinks in, and then daughter feels like she's not good enough and not doing things well enough, and so it can create all these really problematic family dynamics as well. And so that's something to look out for. And then we already mentioned the management fatigue, the idea that I'm just sick of following along this stupid management plan. It's just easier to stay home than go on that bike trip. It's easier to stay home than go out to the movies. It's easier to stay home than try and take on another college degree when I constantly up late eating Cheetos. Because I assume you guys all eat Cheetos late at night when you're working on papers or watching these things, right? Probably not. But there's going to be one person who's like eating chips, and then I say that, and they're like, oh, crap, he caught me, even through the camera. Just kidding. Okay, anyway, I think that's pretty much it. So that is diabetes in the endocrine system. And thanks for sticking with me for this long, and I'll see you again in the next one. Bye, guys.